The breast is composed of specialized glandular tissue surrounded by fat and connective support structures. Inside each breast are lobules, which produce milk, and a branching network of ducts that carry milk toward the nipple. This internal structure is normally organized and highly regulated. The duct system acts like a tree with smaller branches connecting to larger central ducts. These ducts are lined with epithelial cells that divide and replace themselves in a controlled, balanced way. Under the microscope, healthy epithelial cells appear uniform. They are arranged in orderly layers along the inner wall of the duct. Each cell grows, divides, and dies according to strict genetic instructions. Breast cancer begins at the cellular level. Inside each cell is DNA, the genetic code that controls growth and repair. If DNA becomes damaged due to aging, environmental exposure, or inherited mutations, errors can occur. When the repair system fails, abnormal instructions may remain. A cell with damaged DNA may begin dividing uncontrollably. Instead of following normal growth signals, it multiplies continuously. At this stage, abnormal cells begin to crowd inside the milk duct. As these abnormal cells increase, they can break through the duct wall. Once they invade surrounding fatty tissue, the cancer becomes invasive. This step marks the transition from a localized condition to a more serious disease. As invasive cells continue multiplying, they form a cluster called a tumor. In early stages, this mass may be very small, sometimes too small to feel. Over time, growth may become more noticeable. Cancer cells can enter nearby blood vessels. Once inside the bloodstream, they gain the potential to travel to distant organs. Another pathway for spread is the lymphatic system. Cancer cells may move into lymphatic vessels and travel toward nearby lymph nodes, especially those in the underarm region. When cancer reaches the lymph nodes, they may enlarge. This involvement often indicates that the disease is progressing beyond its original site. One of the earliest detectable signs is a firm lump within the breast tissue. Unlike normal, soft, fatty tissue, a tumor often feels harder and less mobile. As a tumor grows, it may pull on connective tissue attached to the skin. This can cause dimpling or a slight indentation on the surface of the breast. If the tumor affects ducts near the nipple, it may cause retraction or inversion. These structural changes can be an early warning sign. Blockage or irritation within a milk duct can sometimes result in unusual discharge. Any unexplained change should be evaluated medically. In some cases, the breast may become swollen, warm, or reddened. Inflammatory breast cancer is rare but tends to progress quickly. Mammography allows doctors to detect abnormal tissue before symptoms appear. Dense areas on imaging may indicate early tumor formation. If an abnormal area is found, a biopsy is performed. A small tissue sample is examined under a microscope to confirm whether cancer cells are present. Comparing healthy tissue with cancerous tissue reveals dramatic differences in cell organization. Early detection greatly improves treatment success. Most breast cancers begin quietly, without pain. Regular screening and awareness are key to detecting changes early. Breast cancer starts with a single altered cell. Understanding how it begins empowers early detection, timely treatment, and improved outcomes. Health 3D. Learn health from the inside.